talk a little bit about an issue that some may, haven't yet talked about, the lack of data surrounding Latinos and COVID-19 here in the area. And only recently has action actually been taken by Mayor Lori Lightfoot and Governor J.B. Pritzker to address the lack of data. However, one Northwestern researcher says that lack of data is a serious problem here.
Emergent data indicate that areas where you have a high concentration of Hispanic or Latinos, that those areas appears to have higher number of people infected.
In mid-April, Dr. Aida Giachella and a group of Latino leaders launched a Latino COVID-19 initiative to show the high number of Latinos affected by the virus.
Area that traditionally you have a high percentage of Latino, those areas are showing an increasing number of infection per day. Our community is disproportionately affected and no one is talking about it. And there's no fatality data, so we don't know how many dialysis we hear from our neighbors, comadre, and other friendship.
Giachella says the lack of data comes from the race and ethnicity question COVID-19 patients have to answer on medical forms. She says the race question, which is typically first, doesn't include a Latino or Hispanic choice.
Latino tend not to answer to question when they ask them, oh, are you white, black, Asian, or what? They don't answer that question.
The African-American community is also unfairly affected, but Giachella says Latinos don't have a clear picture of what's going on.
And if you don't have the data, we cannot really be able to shape policy. We cannot be able to determine what are the area, the reality that our community are experiences. We don't have any data on fatality.
The city of Chicago and state acknowledged there's a problem with the data. Mayor Lori Lightfoot even called it a matter of life and death.
We have to build a foundation to address the health disparities for COVID and beyond.
City officials stated about 4 weeks ago, Latinos were 14% of the city's coronavirus cases, 9% of deaths. Since the city ordered testing services to record racial and ethnic information properly, we're now learning those numbers are much higher, at 37% for confirmed cases and 25% for deaths.
These divides weren't created overnight, and they won't be solved overnight.
Mayor Lightfoot has since made some changes, like launching a multilingual digital and video campaign, distributing postcards and door hangers to impacted residents, and having 3 bilingual virtual town hall meetings for seniors, immigrant youth, and all Hispanics.
The strategy has to be prevention. How can we be able to stop the spread? When you go in our neighborhood to the bodegas and to other small businesses, you realize that they have no protection. There's not the awareness